Thanks for staying on. South Africa's first batch of vaccines will be delivered to the country on Monday. While the development and distribution of vaccines is seen as key to ending the current pandemic, mandatory vaccination should be treated with caution by employers. So says Hugo Pinar, a director at law firm Decker-Hofmeyr. Ultimately, employers should strive to obtain their employees' voluntary buy-in when offering vaccines, Pinar says. Here to unpack with us today the story further, I'm joined by Phetheni Nkuna, Director in Employment Law Practice at Decker-Hofmeyr. Phetheni, good to have you with us.
Thank you for having me.
So what we know is that vaccination is a medical procedure, that is necessary to eliminate the risk of a contagious targeted disease. And we do know that right now we are dealing with a disease that is contagious. However, in order for the vaccination program to be effective, you need broad buy-in in society and community, but more specifically in the workplace, you need a huge take-up of the vaccine.
Yes.
So voluntary procedures in the world so far have proven not to result in that broad takeover. In fact, you look at the USA with their jabbing that's currently going on in the place of employment, about 50% do that. But where mandatory vaccination has been put in place, there seems to be quite a huge uptake of the vaccination. What are the permutations?
All right, so currently in South Africa, we don't have a mandatory system, so to say. I mean, you would have heard in the last few weeks, the minister announcing measures such as the electronic vaccination data system that will come into place. Once you've registered, you then have to give consent. And this is in line with the National Health Act, which says that any person on whom any sort of medical treatment, care, or service that's going to be administered needs to consent thereto. And the issue of what is consent, it has to be informed. The person has to know that that consent relates to this specific form of care or treatment that's going to be administered. And it also has to be voluntary. And again, we would have seen that even from the registration process itself, for people who are going to get the vaccine, that you either say yes or you say no. Now, having to take that and try and sort of interpret it from an employer's perspective, employment relationship, so to say, what does it mean? There are a couple of legal specifications that have to be looked at. We start with the Employment Equity Act, Section 7, which deals with medical testing in the workplace. And it does say that medical testing is prohibited unless it is permitted by legislation, that is required by legislation, or where it is, in terms of social policy, it is a condition of employment, it is necessary to allocate employee benefits, or again, where it is a requirement of a job, then it is permitted. However, that section within itself doesn't override the requirement for consent. Yeah. So that is where the difficulty sort of comes into play. So how do you do
when we are operating in a state of emergency like we are currently, where I suppose directives are given on the go as and when things happen? We now have the vaccines coming on Monday, particularly for the healthcare workers. Will they see themselves in a situation where, particularly them, because they are in the forefront of this fight and highly at risk for that matter, where it becomes mandatory for them to take the jab?
All right, so just to continue on from the Employment Equity Act, it does speak about instances where it is in terms, where it's a medical fact, where it is in terms of social policy. So we might see a sort of leveraging of what the statute prescribes. And again, the National Health Act does say that it does at least provide for two exceptions, and in the first instance is where it's required by law or in terms of an order of court, or where such a person is not vaccinated, they pose the potential of a health risk. So again, frontline workers, obviously you don't want to be treated by somebody who may pose a health risk to you. So we will likely see litigation coming out of that, because interpretation. What does it mean? Do I have the right to say no? As it stands, you have to consent to it.
Potential of a health risk, that's very important because, again, it speaks to this question that whose right then becomes more important here. Because if you're saying a potential of a health risk, it might not be necessarily talking to me as the employee. It might be talking to everybody else that I work with. I could possibly be the potential of a health risk for them. Is their right more important than mine, who might be uncomfortable with that medical procedure? You mean other people are saying, well, it's harmless, just a jab. But I mean, for other people, it might be a big thing. They might really be anxiety and apprehension and resistance to it.
True, and I presume that is why even the National Health Laboratory Service, as well as the minister, have taken the effort to try and explain where this vaccine comes from, what steps have been taken to try and at least get it to a point where it can be administered. That being said, where somebody is working with the public at large, them contracting the virus and still having to service the public, and that in itself does pose a risk, because you would want to have at least the comfort of knowing that this person has been vaccinated. Now, on to somebody saying, I've got my doubts or I've got my fears. There may be an objection by somebody who says, well, listen, can I at least have the right off or go ahead from my doctor? Because I suffer from this and that and that. Can they at least advise me? Because you also don't know what you're allergic to. Is a composition, is something in that vaccine posing some form of allergy? Again, there is that. And then somebody saying, well, listen, according to my religious beliefs, I can't be vaccinated. But again, rights have limitations. It has to be reasonable. And again, the Constitution does specifically speak about that. You may enjoy a certain right, but in the midst of a pandemic, your objection to taking a vaccine needs to be reasonable.
So rights comes with obligations also, don't they? What is the obligation on the vaccine decliner in the workplace? I read in some reports where the employer would force the employee to sign an acknowledgement of the risk that they're assuming.
Okay, so in terms of forcing, again, somebody has to consent, and consent must be voluntary. Where somebody is forced, again, I was actually asked a question on my way here that, what if they threaten to terminate my employment? What then? It's really new ground. It is new ground, and employers are still trying to navigate this. But what some of the possible scenarios that might come to play is probably a dismissal for operational requirements, because, for example, if down the line vaccination does become a travel requirement and I refuse to take it, my employer can say, listen, you can't then render a service to me, therefore I have to terminate you. Then there are issues of dismissal for incapacity, because you now cannot render a service because you have failed to take a vaccine. I then cannot have you in my workplace. But then again, there's also a catch. The Labor Relations Act speaks about reasonable alternative accommodation. If a job can be adapted, as we've seen in the last year, where people have moved to remote working, have used our fourth industrial revolution inventions, if it can be adapted, then is there really a reason to terminate that person on the basis of incapacity? Again, we will likely see this where an employee says, listen, because of my health reasons or because of my religious beliefs, I cannot take the vaccine, but the employer has become so persistent and it's rendering my continued employment intolerable. I'm left with no job or with no resort. I have to resign. So that termed constructive dismissal.
Goodness, it's uncharted territory. We are bracing ourselves for more and more legal action, I suppose, at this particular time, because we've not been here. During the presentation on the service delivery model, we're hearing that there are various modalities to this, including employers being allowed, if they are able to store the vaccine at the required temperatures and they have the facilities and infrastructure, to actually purchase them for themselves and administer them to their workers. In fact, the mining sector already saying we are ready to go for it and actually do it. The cost factor of it, they will buy from government, but can then the employer pass on that responsibility of paying for them to the employee?
That is again uncharted territory, and I would say that in the instance where an employer says, listen, I have now had to put a vaccination policy in place, I have had to adapt your conditions of employment. Again, you cannot change employment conditions without consulting. You cannot do it unilaterally. Where an employer seeks some kind of way to make it compulsory to take the vaccine, then they may reasonably be expected to cover the cost, because an employee may say, listen, I don't have medical aid, I don't have savings in my medical aid, I cannot afford this. So in order to try and ensure business continuity, employers may as well resort to just buying the vaccine and administer it. Whether it can be charged to the employee unless they consent beforehand to absorb that cost from their wages, then that can be taken as valid, so to say.
So in South Africa at the moment, people do not need to worry. They will not be fired just yet, unless, of course, the policy changes. And I'm sure you are getting a lot of consultation at this particular point from employers who are saying, how do we come up with a policy around this particular issue?
Yes, and I think in the coming weeks we will see even the minister, we will see different representatives of employees coming together, as well as employers coming together to try and navigate this issue, because there are social policy considerations, there are legal considerations. I mean, the Occupational Health and Safety Act prescribes that an employer must ensure a healthy and safe working environment. Now, what does that mean? Do I then elevate one employee's objection over the rights of the rest to a safe and healthy working environment? So all of those things, we will likely see the minister coming in to intervene to try and provide some form of guidance on these issues.
Phetheni, I appreciate your time and thank you for coming through tonight.
Thank you for having me.
Phetheni Nkuna, Director in Employment Law Practice at Cliff Decker Hofmeyer. A recap for